So what I'm going to do again is I'm going to feel for whatever it is that she likes to rub out. Like where's the most tender kind of taut points?
Pretty much where you are right now.
Like the whole area?
Yeah.
Okay. And sometimes, and you can see also that this is a little bit more anteriorly tipped. So she may also need a pec minor inhibition. So I'm just kind of going to monitor that. Is that tender?
Mm-hmm.
Right. And it feels a little hypertonic to me, but not so bad. So what I'm going to do to slack this is I'm going to posteriorly tip the scapula. And actually, before even that, what the verbal instructions are. So if this is a 10 out of 10 in tenderness, and I'm not using that on the VAS, I'm just saying like, if whatever this is 10, I'm going to move your head and shoulder around slowly, and I don't want you to help me. So I also don't want you to nod. You can nod now, but not when I'm doing the technique. Because if you say, oh, how's it feel? Or does it feel better? And they say, yeah, it has to be passive. Because anytime this is active, if you've just taken the time to slack the tissues and the tenderness goes away because you reduce tone, because you basically just took the muscle that was taut and you slackened everything according to the origin insertion, kind of moving closer together. If they nod or shake their head, no, it may just come back. So it's supposed to be, someone hold her head. It's supposed to be as passive as possible. Sometimes you have to restart. So I'm going to posteriorly tip the scapula. I could also elevate the scapula. And even sometimes with that, like I'm maintaining constant pressure. If you're doing it right and you're at a really tender point, it should feel to them as if you're not on the point anymore. Is it still tender?
No.
Okay. What I also could have done is just rotate inside, bend her head toward. And if needed, I can also just take, so with my hand that was here, I'm going to take my fingertips and just kind of push the skin together, because sometimes even just slacking the skin will reduce tone. So it's as if I took the scapula and posteriorly tilted it and then kind of rotated it this way, so retracted it, but really I'm just not even retracting it so much, it's just slacking the skin. If you hold this for between 30 seconds and a minute, no more, no less. You take an osteopath course, it's always like 90 seconds. It has to be 90 seconds. I'm like, what if it's 89? Is this not going to work? So I say around 30 to 60 seconds or so. It's not a very exciting technique. I wish I could have a boom or something like that. And every once in a while, you can just move your fingertips around. So I'm moving my left-hand fingertips around where I was palpating. I'm like, how's that feel? Still okay?
Yep.
Yeah. So the key to keeping that tone low is slow passive return. Because what happens with a quick stretch? Yes, you activate a stretch reflex and you have increased tone. So that slow passive return is okay, and patients want to help. So
It's fine.
Loosey-goosey?
Mm-hmm.
Good. And what I would have also have done is recheck her retraction and side bending to that side. I should have also checked her ulnar nerve. So we're just going to lead right into this. Can I do this?
Yeah.
Okay. So to review ulnar neurodynamics, you're going to depress the scapula as much as possible. And then I just kind of, could you scoot down that way a little bit? Yeah, so I'm going to press the scapula as much as possible. Then I like to jam my fist into the table to kind of hold it there. You're going to abduct the shoulder, fully externally rotate, full elbow flexion, full pronation. How's that feel? Anything yet?
Nothing yet.
Okay, good. And then wrist and finger extension, and you want to make sure that you also get the DIPs, and then I need to walk it up into abduction a bit more. How you doing?
That I feel.
Okay. Is that better than normal?
Yeah, normally it's, I can't get my hand that close to my face.
Yeah,